I'm Marc Nevins. In this video, we'll present minimally invasive immediate implant placement with connective tissue graft using the Marc Nevins implant. This maxillary central incisor is fractured and has loss of the buccal plate. Minimally invasive extraction is performed utilizing piezo ultrasonic instrumentation so that the tooth can be gently removed with a forceps. The extraction socket is then debrided and degranulated of any inflamed tissue prior to beginning the implant site preparation. I'll utilize a piezo ultrasonic instrument to penetrate the palatal wall, and then I'll follow this with my 2mm twist drill. We'll then prepare the implant site using uniquely designed multi-drills, which will precisely prepare the osteotomy. We'll go through 3 multi-drills here using number 2. Then we'll go to the number 3 multi-drill. We're drilling to a depth for a 13mm implant, and here with the number 4 multi-drill you can see that we're going at the top of the black line at the level of the soft tissue, just about 15mm, so the platform will be at least 2mm below the soft tissue level, placing our 4.2 by 13mm Marc Nevins implant. The implant is going to be delivered utilizing the motor mount on the handpiece with a torque set to 45 Newton centimeters, and we can see that initial high primary stability is achieved, and we'll check the tightness of the implant using our ratchet wrench. Once the implant has been placed in its final position, I'll then evaluate for the soft tissue grafting utilizing a tunnel technique, here preparing the tunnel with a periodontal probe. I will then place a 2mm healing abutment, which will help support the height of the tissues. And once the tunnel has been prepared and the healing abutment placed, I will harvest a connective tissue graft from the maxillary left palate. The connective tissue graft is harvested from the palate utilizing 2 parallel incisions, and I'll be able to harvest a quality connective tissue graft, but I'll have a wound that will easily be closed with a single running continuous suture. You can now see the graft being placed into the tunnel, and it will be stabilized with an absorbable chromic gut suture. Once the graft is stabilized, I'll begin to condense the base bone freeze-dry bone allograft into the surrounding extraction socket between the dental implant and the alveolar walls, as well as between the dental implant and the connective tissue graft where we're missing the buccal plate. A collagen membrane is then placed over the coronal aspect of the socket and stabilized with medical grade cyanoacrylate. At 12 days healing, we can see the advanced healing, and we can see the post-operative radiograph. Little Implant Company looks forward to sharing more surgical videos with you in the future.